wanted to give a quick update. It's day 56 of isolation. It's May 2nd. My PCR test came back negative from LabCorp on April 27th. And then I just did another one on April 30th, so I'm waiting to hear back. So hopefully I'll hear back something today, tomorrow, or Monday, and then I can be off isolation. I'm ready to get back to work. I'm ready to be around my family and friends. The whole test-based strategy for healthcare workers is horrible. I can't imagine too many other healthcare providers being in isolation for 56 days. If that happened, then we would not have the hospitals and clinics and stuff staffed. So I decided to follow the conservative method, which the CDC put out for 2 negative tests in a row, but that hasn't worked out very well. I've gone through 10 PCR tests through the state. 6 of them have been positive, 2 have been negative, and 2 have been indeterminate. So my husband and I, last week, we decided to go to Denver. After talking to the state and the CDC, we did a test with the state, and that was positive. And so we also decided to go through LabCorp. So I use LabCorp through my little clinic in Crested Butte. It's called Sopris Women's Clinic, and we decided to do my testing through LabCorp. So we did do blood testing. My IgG came back positive for antibodies, which is great. I'm still waiting for my IgM and my IgA. And then my first PCR test came back negative, which was April 27th. Waiting for the April 30th test to come back. So the testing that they're using, the PCR testing, is really, it's painful. Like the last test that I had on April 26th, that was probably the most pain that I felt, but just felt like they were getting brain matter. They went really deep and it was really hard. They wanted to make sure that they got a great specimen. You know, the doctor's like, make sure you get it really good. You know, that in itself, and having to put multiple patients and healthcare providers and the general population through that type of testing, it just is, it's barbaric, honestly. Like, it doesn't seem right in our world today that we'd have that kind of testing. After 10 times, 11 times, 12 times, it just gets old. The whole procedure gets old. So it'd be nice if there was a blood test or an antigen test, something that could test you rapidly in the clinic or the hospital or through public health to find out, hey, you have this, within 5-10 minutes, go home, isolate, or you can go back to work or proceed. Anxiety too, like I definitely have a little anxiety about going out and reinfection, re-exposure, shedding, spreading, going to see patients in the clinic again and making sure that I'm protected, but also like really making sure that my patients are protected too. I need to have a good game plan before I go back to the clinic and open my doors again to make sure that, you know, because I'm not a screening site, I want to make sure that my patients are protected, but my family and friends and community are protected too. So they still have public health that's doing the screening. I want to offer antibody testing and I want to help people, but I definitely have a lot of anxiety about being back in the community again. You know, the whole stigma of having COVID-19, even though it's been out there for a while, I was one of the first cases in our community, and so you just wonder like what people think and their thoughts are, and if you're truly still negative. So I have a lot of anxiety with that. But my community is very loving and very supportive, and we have received nothing but love and support. There's a few people that have been negative, but that's okay. There's always those type of people in the world. Anyways, life is good, and I'm just happy to be outside breathing some fresh mountain air. The state sent off aviral culture to the CDC, so I'm waiting for that to come back as well too. So hopefully this week will be the week that I am out of isolation, but lost a lot of faith for sure in the test-based strategy for healthcare providers and just the testing in general. It's been horrible. It's been a nightmare. You know, after doing a lot of research and looking that the PCR test is really emergency use only as well, and it has a 66 to 67% accuracy rate, and that's the gold standard test. We have got to come up with something different. Anyways, I am in my happy spot here. Just kind of wanted to show you where I was at. It's beautiful. My husband took me out to work with him today. He works in the forest, in the woods, and I'm just doing a little walk and just relaxing and enjoying some fresh air. I have my buff on. Stay healthy, stay positive, stay safe, stay at home if you're not feeling well. Stop the shed, stop the spread, and just protect your family. So I'll give you an update this week, hopefully, fingers crossed. Lots of good vibes and thoughts that this will be the week that I'm finally done and out of isolation. So thanks for following my journey and spreading it and sharing all my posts. I think it's been really helpful for a lot of people, and I'm here. If you have questions, please email me, text me, call me, Facebook me, do whatever you need to do to get in touch with me, because I'm really happy to help. So anyways, thanks, and I'll see you guys soon, hopefully with some great news.